Hi friends, we are live on Facebook. I'm Himanshu Sharma, welcoming you all to this live session. Today's focus is on blood disorders and bone marrow transplant, or BMT, what is commonly known as. Blood or hematological disorders, which were once thought untreatable, now have a solution. Thanks to the developments in medical science, there are ways and methods to manage some of the most complex blood disorders with treatment options. Have you heard of bone marrow? Not sure of how many of us would actually know what bone marrow is, so I'm just going to quickly take you through what exactly bone marrow is. What exactly is the part of our body that bone marrow is, where it's located. So it's a soft, spongy tissue in some specific bones like the thigh bone and the hip bone. This bone marrow is a warehouse of stem cells. You know what? These cells are magical. Why magical? Because they can clone themselves, replicate themselves, and mature into different types of healthy cells. What we commonly refer to as red blood cells, white blood cells, and platelets. Remember class 6, class 7? You would have come across these, and I'm sure you can always go back to Google and check what these cells do. So all these types of cells are formed in our bone marrow. Our medical expert today is Dr. Nidhi Jain, consultant Heamato-Oncologist and bone marrow transplant specialist. She's with Zydus Cancer Centre. Dr. Nidhi, welcoming you to this live session today. With your permission, I would straight away like to go ahead with questions because we have a long list of questions to be covered today, right? Okay. So my first question, Dr. Nidhi, is, are stem cells and bone marrow transplant the same? Who are the patients who require this therapy?
First of all, thank you so much, Mr. Himanshu, for having me here, and welcome to all our viewers for this very important session on bone marrow transplant. And particularly, I'm really glad to share this information to all of you in this month, September month, which is the month of blood cancer awareness. So we would like to share some information with you regarding bone marrow transplant. As you like, the first question which goes is whether bone marrow transplant and stem cell transplant are same or not. So, bone marrow transplant is now better known as stem cell transplant. Rather, I would say that it is more aptly known as hematopoietic stem cell transplant. And as you very rightly mentioned, that these stem cells are really magical cells. Why magical? As you've already mentioned, that they have the capacity to produce billions of blood cells, that is the red blood cells, which carry oxygen throughout our body, white blood cells, which are very important to fight with infection as well as cancer, and platelets, which are important to control the bleeding. So all these three blood cells are very important for life. And if suppose there is any problem with our stem cells, that means if our blood forming stem cells are either damaged because of cancer, or they are damaged because of the high dose chemotherapy or radiation therapy used in cancer. So in that situation, the patient will not be able to produce the blood cells, that is the RBCs, WBCs and platelets. And as a consequence of which, the patient can have very serious problems like anemia. They can have repeated infections because of low WBC. They can have increased bleeding. And all these things can actually be very life-threatening. So whenever we, in stem cell transplant, what we do is we replace the diseased stem cells with the healthy donor stem cells, and with that, the bone marrow restores the capacity to produce the normal blood cells. Now, just to elaborate a little more on the difference between the bone marrow transplant and stem cell transplant. So these stem cells are mainly found in our bone marrow, but in very small quantity, they can also circulate in our peripheral blood, and we can also obtain stem cells from the umbilical cord of newborn. So thus, all these three sources, that means bone marrow, even from the peripheral blood and the umbilical cord, we can take stem cells and we can use it for stem cell transplantation. So whenever we take the stem cells from bone marrow, it is known as bone marrow transplant. Whenever we do collect the stem cells from the peripheral blood, it is known as peripheral blood stem cell transplant. And when we do it from the umbilical cord, it is known as umbilical cord blood transplant. And today, practically, we have all of us have shifted to peripheral blood stem cell transplant, and almost 80% of the stem cell transplant which we are doing now is the peripheral blood stem cell transplant. Now, the second part of the question which you asked, that which are the patients who actually need the stem cell transplant? Okay, so the stem cell transplant is required, or it is, I would say, a life-saving curative modality of treatment for certain types of very deadly blood cancers, such as acute leukemia, to be more precise, high-risk acute myeloid leukemia, acute lymphoblastic leukemias, which are not responding to the usual optimal chemotherapy regimen, then advanced phase of chronic myeloid leukemia, and certain other very complex but rare disorders such as myelodysplastic syndrome and myelofibrosis. Apart from this, there are certain non-cancerous conditions such as aplastic anemia, which is a type of bone marrow failure syndrome. Then certain genetic anemias such as everyone must be aware of thalassemias and sickle cell anemia. These are also again two disorders where stem cell transplant is really successful now. Apart from this, there are certain congenital immunodeficiency disorders wherein a child is born with very weak immune system, such as, for an example, I would say severe combined immunodeficiency disorder. So all these disorders can be treated with stem cell transplantation.
Thank you. That was vital information for many of us who probably would be Googling with a lot of information. So this is right from a doctor's mouth that we are able to listen and understand what exactly is the therapy that we are going to talk about, that is bone marrow transplantation. Another question which a lot of us have in our minds and we look for answers is chemotherapy a must prior to any kind of a bone marrow transplantation or a stem cell transplantation?
Okay, so chemotherapy before a stem cell transplant, that means you want to know whether before giving the patient stem cell infusion, whether we need to give them chemotherapy or not. So yes, it is almost before every stem cell transplant procedure, the patient requires what is known as a conditioning regimen or a preparative regimen. That means we give these patients very high doses of chemotherapy, and the purpose of giving this chemotherapy or radiation therapy to these patients is that one thing is that this intense chemotherapy will destroy the remaining cancer cells in the body of the patient if we are treating a patient of blood cancer. So as and it will also form a space. It will damage or it will destroy the diseased stem cell, and it will form a place for the normal healthy stem cells. So after this preparative regimen, when we give the stem cell infusion to the patient, these healthy stem cells can make their way to the bone marrow and they can produce the normal blood forming cells. The other purpose of giving this preparative regimen or the high dose chemotherapy regimen is to make the patient immunity go down or suppress their immunity, because whenever we are giving the donor stem cells to the patient, then the patient can react and to these donor or the foreign stem cells, and it can lead to graft rejection. So even for that purpose, this preparative regimens are important, and this will actually in a way it will help the other or the healthy stem cells to form its place in the body.
Thank you. That was quite informative. So it is a must before we proceed for any kind of a bone marrow transplantation. You expect the chemotherapy to be done for obvious reasons to make way for the healthy cells to regenerate themselves. Another question which many of our viewers have put across is about allogenic and autologous transplant modalities. If you can just throw some light on this.
Sure. So it is very, very important to know these two types of transplantation separately. Now, autologous transplant or autologous stem cell transplant, what does that mean? As the name suggests, here we are going to collect the stem cells from the patient, and we are going to re-infuse these stem cells back to the patient. Now, this basically is done mainly for only two disorders or two blood cancers. One is multiple myeloma and the other is a relapsed lymphoma. So why do we infuse the patient's own stem cells? So here the idea is that first we collect the patient's stem cell and keep it aside, freeze it, and then we give the patient very high dose chemotherapy so that we destroy all the remaining cancerous cells in the patient's body. Now, what happens in this process is that apart from the cancerous cells, even the normal healthy stem cells of the patient is also destroyed. And if suppose we do not rescue the patient with this autologous stem cell, then the patient will not be able to form the blood forming different blood cells, and which can be life threatening for the patient. So in a way, autologous stem cell transplant is actually known as a high dose chemotherapy followed by an autologous stem cell rescue. Now, this autologous stem cell transplant, as I mentioned, is done only for specifically for these two conditions. Now, if I talk about allogenic stem cell transplantation, now allogenic stem cell transplantation means we procure the stem cell from a donor and from a healthy donor, and then we give the patient high dose therapy, and then we give this healthy stem cells, we infuse this healthy stem cells to the patient. Now, this solves two purposes. One, as I already mentioned, that it is going to destroy the diseased and the damaged stem cell in the patient body, and it will also destroy any remaining cancerous cells in the body, and it will make the way for the healthy stem cell. Second important function of this allogenic stem cells which we give to the patient is what is known as graft versus tumor effect. Now, this is very important in case of when we are treating cancer patients. So, these cancer patients may have some residual cancerous cells in the body, and they can later recur, or the cancer can relapse. So, when we give this other donors, healthy donors, graft to the patient, so this graft will have WBCs, which will actually go and attack the remaining tumor cells in the patient's body. And this is known as graft versus tumor effect, which is really very important in treating some types of very nasty blood cancers. But simultaneously, I would also like to mention that the picture is in allogenic transplant particularly is not that rosy. In this process where the graft is killing the tumor cells, it can sometimes even attack the normal cells of the patient and lead to a very devastating complication, which is known as graft versus host disease. That means the graft is going to attack the normal cells of the patient's body, and particularly these are the cells of the skin, liver, intestine, bones, eyes. Okay, so the graft versus host disease particularly affects these organs. If suppose the GVHD is a milder one, if it is just a grade 1 GVHD or a grade 2 GVHD, still it is good for the patient. But if suppose the GVHD is a grade 4 GVHD, then this itself can become very life-threatening for the patient. So in one way, when the stem cell transplant can lead to cure in many cancer patients, it can also be very hard with the body. But mind you that we are using this treatment modality, this allogenic stem cell transplant, for such patients who have no other option. If we do not do this allogenic stem cell transplant for them, probably they have no ray of hope in their life, and they can even succumb to their disease. So that is why we have to take this chance. Fortunately, as we are becoming wiser now, we can better control this graft versus host disease, and the outcome of the transplant, this allogenic stem cell transplant, is actually improving day by day.
Thank you. This was vital information, and you simplified it to the best extent possible so our viewers would be able to relate it to in a better manner. Another interesting thing which usually comes to our mind when we talk about any kind of a cancer treatment, we always associate it with success rate and a failure rate. I would like you to highlight some points which determine the success of bone marrow transplantation or stem cell transplantation as a procedure.
Okay. So one thing which it should be very clear that the bone marrow transplant or stem cell transplant is not just one procedure for everyone. It's not that that one size fits all. And other thing is also that it totally depends upon which disease we are treating. Like for example, if I'm talking about an allogenic stem cell transplant for a severe aplastic anemia patient, then it does wonders for that patient, because the cure rate is almost to the tune of 80%. If we treat a very severe aplastic anemia with a matched sibling donor transplantation, he is almost 70 to 80% of the time free of the disease. Okay, but if we talk about some other disease, like I have mentioned previously in the indications of transplant, which is known as myelodysplastic syndrome or myelofibrosis, these are some conditions where there's no other treatment option, then we opt for stem cell transplant. But unfortunately, the success rate is not that great. I mean, it is to the tune of 30 to 40%. It depends upon the patient profile as well. Okay. Other thing is that we also should be aware about what is the goal of transplant. Like if I talk about autologous stem cell transplant for a multiple myeloma patient, then the patient should be well aware that this autologous stem cell transplant can never give a cure to the multiple myeloma patient, but it can control the disease to a greater extent, and it can prolong his lifespan by now even by 5 to 6 years. Okay, so it totally depends upon which disease you are treating. Now, there are various other factors on which the success of this stem cell transplant or bone marrow transplant will depend upon, like say age of the patient. So, if suppose the lesser the age, the better is the success rate, and this is because they tolerate the conditioning regimen really well as compared to older patients. But once upon a time, we used to, just treat patients below 50 years of age with a stem cell transplant or a bone marrow transplant, because the conditioning regimens which we use, they are really very, they are not tolerated by patients if they are of, age beyond 50 years. But now, with improvising upon the conditioning regimen, we are now using reduced intensity conditioning regimens, and we can even do stem cell transplant or bone marrow transplant for patients beyond 50 years of age. Okay, so age is another determinant. Then the next is whether the patient has got any underlying medical disease or not. What is the general condition of the patient at the time of transplant? So if suppose a patient already has a lot of underlying medical conditions, cardiac ailments, any decreased lung function or kidney function, then definitely they will not tolerate the conditioning regimen and the transplant procedure that well, and the outcome will be less successful. The next important thing is that what disease stage are we taking the patient up for transplant, or what is the disease status of the patient? Meaning thereby that if suppose we take acute leukemia patient up for a transplant, then at the time of transplant, the patient to have the best outcome should be MRD negative, or by MRD what I mean is measurable residual disease negative, which means that the patient should have least detectable cancer cells in the body. Whereas if we transplant the patient in an active disease, then there is a very high chance that the patient may relapse after transplant. Okay, and in this, I would actually like to suggest that sometimes the patients are referred to us quite late. They require transplant after the first chemotherapy, but maybe the patient is not sent to the transplant physician and keep receiving multiple lines of chemotherapy. Now, once the patient receives multiple lines of chemotherapy, their body becomes really weak to bear this whole process of stem cell transplant or bone marrow transplant, and then the success outcome will definitely go. The success rate will definitely go down. One last thing which I want to mention regarding the outcome would be the donor source. That means from which donor are you procuring the stem cells? Whether it is a matched sibling donor, or it is an unrelated donor, or it's an umbilical cord. So it will also depend upon that.
Thanks. So we know because it's a multimodality treatment, it involves a lot of consultations with various doctors. It's very important for us as people, normal people, patients, also to understand as to they should read more about it, and they should be in touch with the right doctor who's going to guide them at the right point in time for bone marrow transplantation. If you delay it much, obviously the failure rate is definitely going to be higher. Dr. Nidhi, now I would like to discuss something about the donor aspect of it, right? Because it is not something which, again, as you said, that for every patient, whether what diseases they are suffering from, what is their age, what is their overall health condition, all these things matter. So I'm sure there would be similar aspects which are applicable for the donors as well. So first of all, how do we determine that who's a good donor? In general, I mean, I'm sure there would be a various bifurcations and various segmentations on this, but in general, who would be a healthy donor? Let's say if I want to donate, what is that basic things that it's not as simple as blood donation, I believe. So if you can just highlight that part. And secondly, if somebody does not have a donor who's from the same family, what should they be looking for?
Right. So the answer to this question carries a very important message in itself, that we'll come to know. So donor, that means we are talking about allogenic stem cell transplant. The question of a donor comes only in case of allogenic stem cell transplant. So the best donor for an allogenic stem cell transplant recipient is a matched sibling donor. Now here, what do I mean by a matched sibling donor? What do we match? So here we do not match the blood group. What we match is the HLA. Now what is HLA? So it stands for human leukocyte antigen. And what is this human leukocyte antigen? So these are basically protein markers which are present on almost all cells of your body, and it is your immune system with the help of this HLA basically recognize that which cell belongs to you and which cells do not belong to you. So it is very important to have a very closely HLA matched donor so that the recipient accepts the stem cell in a better way. So what we require is how an individual gets this HLA. So this HLA, basically an individual, 50% of the HLA will come from the father and 50% of the HLA will come from the mother. So any individual is 50% HLA matched or a haploidentical match with either of the parents, and a 50% or a haploidentical match with their children. But if you want a full house match, which we call it as 10 by 10 HLA match, so there is 1 in 4 chance for any individual to have a sibling, fully matched sibling donor to be available. That means at any given point of time, now our population statistics now it is approaching in that way that we have very smaller family, the number of siblings have gone down. So the chances of getting a fully matched donor in the family really becomes very less. So to say, at present there are around 7 out of 10 patients suffering from this blood cancers or blood related disorders who may not find a donor in their family. So what is the option for these patients? So there are two options. One is finding a donor, unrelated donor in the stem cell transplant registries, and second is a haploidentical transplant. So what do I mean by a matched unrelated donor transplant? That means there are various stem cell donor registries worldwide, and there are two Indian registries as well. Okay, so healthy donors can enroll themselves in these registries to donate their stem cells voluntarily. Any healthy individual between 18 to 50 years of age group can opt to become a stem cell donor and can be a lifesaver. It is a very simple process. I would like to break a myth over here. This, as you were asking whether it is as simple as donating blood or not. So yes, let me tell you that it is as simple as donating blood. Because as I told you that nowadays we are not doing bone marrows to collect the stem cells. What we do is we mobilize the bone marrow stem cells into the patient's peripheral blood, and we collect these stem cells from the peripheral blood itself. Only 300 to 350 ml of blood, which is collected from the peripheral IV axis, and that's it. You can be a stem cell donor. So it is a very simple process, and by just giving your 300 to 350 ml of blood containing stem cells, you can really be a lifesaver for somebody. Now, the next option which I told you was a haploidentical transplant. Suppose the patient is not getting any donor even in these registries, because it is very difficult to find a donor. As you said, that people really are not they are unaware about registering themselves in these registries and donating the stem cells. People do not come forward that easily, so it's very difficult for a patient to find out a fully matched donor in these registries. So for them, the option is to go ahead with the haploidentical stem cell transplant. Now, any patient at a given point of time mostly will have a haploidentical donor, either in the parents or their children, or even the siblings can also be sometimes haploidentical match. So now over the past 5 to 6 years, we have really advanced in the whole technique of doing this haploidentical transplant, and the success rate is day by day improving. So this is all about the donors.
That was interesting. So I never knew that it's as simple as just donating blood now. So that's really a vital information for all the youngsters and people who are willing to go ahead and walk a little extra mile to help others. That was really fantastic. Uh, Now coming to the time duration, because obviously it's heard that BMT takes ages, it's a long process, you need to be confined to a place, almost like quarantine. So I would like to just understand from you average duration of a complete BMT treatment while you're in the hospital. What is that duration? And then how frequently does our patients have to come back for a follow-up check?
Okay. So again, one more myth buster over here. Like most of us, most of the patients, they believe until the time they are not in contact with the transplant physician that a bone marrow transplant or a stem cell transplant involves a surgery. But let me tell you, bone marrow transplant or stem cell transplant does not involve any surgical procedure. So what happens is, as I have already mentioned, that the patient needs to be admitted in the BMT unit. Now, this BMT unit is a very special, unit which is isolated from the rest of the hospital. It contains HEPA filters, and it is built according to the ISO 1000 guidelines for a isolation room. The patient needs to be admitted in this isolation facility because they are at very high risk of getting infections from outside. Their immunity is very weak during this entire process of bone marrow transplant, so they need to be admitted in this HEPA filtered BMT unit. And now, first, what we do is we give preparative regimen to the patient, and then we infuse the stem cell to the patient. And after that, because of the preparative or the conditioning regimen or the chemotherapy which we gave to the patient's own blood cells will be really low. Their WBC count, their platelets, their hemoglobin will really drop down to a very significantly low level. And during this period, we need to protect the patient from getting any infections from outside. So after infusing the stem cells, then we wait for a period of around 10 to 14 days in a case of autologous stem cell transplant. During this process, the stem cells which we've given to the patient, they go to the bone marrow of the patient and they start forming the new blood cells. This is known as, once they start forming the new blood cells, it is known as engraftment. So once the patient have a good or a safe count, after that the patient can be discharged. So this whole process is around 10 to 14 days in case of autologous stem cell transplant, but in case of an allogenic stem cell transplant, this duration will be prolonged to around 3 to 4 weeks. Yes, during this period, the patient definitely has to be confined in this BMT facility of the hospital without any contact with the outer world. But it is for the patient's own betterment only. Because if suppose they acquire any infection from outside, then the whole process will really become very difficult. Now, what happens is after this engraftment or when the patient has got a safe count, and after that the patient can be discharged. In autologous stem cell transplant, the patients generally do not require any other medications after that. But in an allogenic stem cell transplant, the patient has to be on immunosuppressive medicines so that they do not develop GVHD, and they have to be continuously under the supervision of the doctor. Initially, for the first 100 days, there is a very high chance of acquiring infections from outside. So that is why they need to visit the doctor's clinic initially every a weekly basis, and then later on every 15 days. Sometimes the immunosuppressive drugs can be stopped at 6 months, but then in some patients it may continue for a year or so, depending upon what is their GVHD level.
So that was nice information. It has at least helped me understand. I was thinking that, for months together, they are hospitalized. Obviously, for a few weeks they would be there, but yes, definitely, even after the transplant is done, for like depending upon how one is responding, could be 6 months to a year, that you have to be more careful, right? Thanks a lot for that information. Now, coming to the place where you work, the Zydus Cancer Center, I would like to understand three things from there. What are the different treatments that you are offering specific to the blood disorders? And a little bit more on the facility that you offer specifically for the BMT patients.
Okay. So I've been attached to the Zydus Cancer Center now for quite some time, and I'm really very lucky to be in such a center, which is a comprehensive center where under one roof we can treat almost any type and every type of blood-related disorders, all types of blood cancers, and this immunodeficiency disorders as well as aplastic anemias, right from their diagnosis to their treatment, and even to the the latest technologies and the diagnosing these patients. The most toughest cases can be diagnosed at our center. We also have a bone marrow transplant facility, which I'm proud to say that that is the largest bone marrow transplant facility at present in Gujarat, and it is to the almost to the level of the international standards. Now, as I told you that we offer all types of treatments in the form of chemotherapy, immunotherapy, targeted treatment to all our blood cancer patients, as well as we can take them up through this whole complex process of bone marrow transplant. With regard to bone marrow transplant, I would like to make a point here that taking the patient through this difficult journey of a stem cell transplant or a bone marrow transplant requires a very dedicated team effort. It is not a one-man show at all. It requires a constant and dedicated effort by the transplant physician, by the the diagnostic facilities, that is our radiologist, our radio diagnosis facility, our microbiologist. Very important are a constant blood bank support and the support from the transfusion medicine department, because we have a very good in-house transfusion medicine department, so we can do the stem cell collection in the hospital itself. Apart from this, we have full support by the radiation oncologist. So if suppose any patient requires TBI or total body irradiation as a part of the conditioning regimen, we can do it in-house there. Apart from this, we have a very good intensivist with us who is available round the clock. So if suppose the patient has any problem anytime, then it can be taken care by the intensivist as well. Apart from this, very important group of people in the care of these transplant patients is our nursing staff, and we have really very dedicated team of nurses, BMT trained nurses with us. And it is, as I told you, the success totally depends upon the teamwork, and all of us work tirelessly and dedicatedly so as to improve the outcome of our patients of blood cancers as well as blood related disorders.
So the teamwork is the key word here for any kind of a treatment to be successful, especially pertaining to something which is relatively recent. If you look at the medical history, medical treatment history, it's very important that you have a setup where everything is available at the same place. You have all the doctors available at any point in time that you may require. And there is a dedicated team of people who are supporting the ancillary services also, because that makes your stay, your treatment, I mean, their role is equally important in the whole exercise. So friends, I'm pretty confident that today's session have added a little more knowledge to you, and the complex issue of bone marrow transplant or stem cell transplant has been addressed. So it's important for us not just to be takers or consumers, but also givers to the society we live in. Thousands of people across the world, as we talk, would be detected by blood-related disorders each day. They look up to donors who can help them live. So remember, friends, in some diseases, you are the medicine. I'm just going to show you a slide, and I request you all to take a note of it, that we need to assist people, we need to assist the society. So it's important that you register yourselves with an available registry. for bone marrow transplantation. You can be donors, as Dr. Nidhi explained, that this particular process is not very complicated. So please be a hero. If you want to be a hero, donate bone marrow. We all have been talking about blood donation, and this donation should not be neglected. So bone marrow is equally important. There are many people who we would not even know that they are suffering from diseases which require bone marrow transplantations, and they would just perish. They would not even know where to go for information. So all those who are watching this session, I would request you that please share this information. Please visit one of the registries which is available in India, register yourself, and try and help as many people as you can. Thank you very much, all of you, for joining us. Thank you, Dr. Nidhi, for finding time and talking to us. Thank you, and have a lovely time.
Thank you.